we heard that it's important to invest in rare disease research at two levels. One level would be openness of all health research budget to rare disease projects, based only on the criteria of excellence, without taking into account the criteria of rarity of the disease. So that's very much what was called the bottom-up approach, where we can see new concepts, new ideas, new technologies emerging, which can apply to rare disease, but also to more common diseases. And that's where we can have some making some skips in terms of knowledge and scientific progress. But we also need a second level of investment in research. That's the specific rare disease budget lines for funding of networking. And that came back very often, networking, national level, European level. And tools like the biobanking, the registries, the clinical trials in preclinical and clinical trials, phase 1, phase 2. And for that, it needs a program approach, a more targeted approach, and again, sustainable funding. And here, it was proposed to have both national budget lines for that in the context of national plans, but also to have a protected budget into the European program, and particularly in the next FP8. So this issue of sustainability and continuity, Manuel Allen explained us that research project now can be funded not only for 5 years, but even up to 7 years, and that they potentially can be renewed, that there is no really limit to that. So that's the good news. On the other hand, all of us understand that they cannot guarantee any continuity of funding with any public money, and that's certainly a good principle as citizens in general. But we need to find a way still on how are we going to fund this strategy on the long term. How can we get scientists getting into European network, developing registries, creating infrastructures, biobanks, and being always uncertain about the future of that funding? We certainly all agree that it needs a review, an assessment of the quality of the work performed, of the outcomes, of the results, and etc. But still, we need to find a way to provide them with more sustainable funding. If not, we're creating network, which can last for a few years, and then it stops and we move to the next disease. We're losing our money. It's not a good investment neither. It's important, it was said plenty of time, to promote collaboration between scientists, clinicians, patients' organization, and industry, which was not too much present today in the panel or among the speakers, but very present in the room. Thank you to you. And it's important to have these 4 stakeholders inside rare disease networks, both at the national level when possible, and certainly at the EU level, which is the most relevant for that collaboration. We are in one health area where new type of collaboration is being pioneered. That has been mentioned by one of the person from the audience, where we are innovating in terms of governance. That was Volker Straub, in fact, governance of research in terms of co-production of knowledge, and it's an emerging field of experience. So we cannot take for granted that we know how to do it. We still have to learn how to do it, but we have some experience already on which we can build, and that's something that maybe we need to collect more about the practices and progressively try to identify what can be the good practices of that collaboration. So far, we have worked very much on patient groups and industry, academia and industry, very much on 2 by 2, but not as a group inside the European research networks. Another third strong message that we heard today was to say that there is clear rationale for pan-European approaches for rare disease research by the Commission at the DG Research, and that's about sequencing of human genomes and research advances in postgenomic, the translational research, the translation of basic discoveries into clinical applications in human health, which suppose the multidisciplinarity, clinical research and international cooperation for that, and health policy-driven research. And in all these aspects, Manuel Allen insisted that patient organizations have a role to play both in advocating but also in catalyzing research. As part of the strategy, this competitiveness at large is important, and to keep in mind that we're in the context of worldwide competition, certainly even more so when it comes to rare disease. We know it's global niche market for drugs, but it's also very small area of a scientific community working on these diseases. So the worldwide competition is important, and the openness of the European Commission call for proposals for research teams from outside Europe is very important, and we thank you for that. Development of norms and standards are important, and that has been mentioned on several occasions, including on the ethical aspects and methodological aspects. And that's probably something we need to take more into account into some of the projects, or even develop specific projects around that. The Commission advised us today very clearly, both this morning, Robert Madlin, but also Manuel Allen this afternoon, to prepare for the next framework program, whatever it is called, but for the next framework program. So to insist more on this collaborative research on rare diseases, what is the European added value, what's the contribution of EC policy to EC policy objectives, and also the EU research potentials based on stakeholders' consultation. And Manuel Allen insisted that the rare disease community needs to speak with one voice on that. And I will go back at the end of my presentation, of my summary on that point. Because when we think back about our day today, clearly we do have converging messages, but we have bits and pieces, and that doesn't come into one message in order to support the people who want to do good in ministries of research to support rare disease research, or the people who want to do good at DG research of the Commission. So they need to have a clearer and consistent message, and we can help working with them on that. We heard from Domenica that we do have now draft recommendations for national strategies on rare diseases. So I will not repeat them because that was made very clear, and we understood that this is a base which now will be discussed with the public authorities, which will be enriched from the debates through the 16 national conferences, and also it will be enriched over years based on experience and the feedback of experience on that. So it's going to be an ongoing process over the years. But what I would like to see into that is a better connection between a specific reflection process on this pillar of research in national plans with the strong and growing work of EURORDIS, where the actors are there also, and linking that a bit more with DG research so that we really come to a comprehensive and integrated strategy.